Welcome back, everyone, to the Adrenal Fatigue Podcast. We're so excited today. Dr. Holly is here with us, one of our in-house naturopathic doctors. She's been specializing in women's health and hormone issues like adrenal fatigue, perimenopause, menopause for over a decade. So we're super excited to jump in and have a conversation about perimenopause today. Thank you for joining us, Dr. Holly.
Thanks for having me. It's great to be back.
Always great to have these conversations with you and to share them on this podcast to our community. And today, we're talking all about perimenopause, which is actually it's not talked about a lot, but this is a huge topic and it's affecting women to a huge degree. And our goal today is to really show you how adrenal related and stress related it really can be, perimenopause and menopause. And when I say related, I mean related to the symptoms you may be experiencing during these transitional times of your life. So can't wait to have this conversation with you today, Dr. Holly. And I think maybe a great place to start is just, what is perimenopause anyways?
Yeah.
Like, when does it start? What does it look like?
Yeah. This is so interesting because menopause is talked about a lot in medicine and in our culture, but perimenopause is a huge blind spot. And so a lot of my patients are in the perimenopausal years, which technically can begin 10 years prior to menopause. And menopause by definition is 1 year with no periods. So it's just that moment where that year has passed. And then after menopause is postmenopausal. So perimenopause can be up to 10 years prior to when the periods stop.
And that's a big window.
It's a big window and a lot happens during it. And a lot of it goes unnoticed. A lot of it, people expect symptoms like hot flashes. We all kind of know, okay, that's menopause, right? That's what we think menopause is. But those hormones start to shift much, much earlier than when those overt symptoms like hot flashes show up.
So what are some of those? It is really interesting. And that window, is pretty large. So what are some more symptoms besides the hot flashes, perimenopause? What do those symptoms and signs look like for most women?
So a lot of them are menstrual. Those are when it's the most obvious, right? So I'll often have perimenopausal patients come in, and it's when their periods start to be irregular. So maybe they used to be, 28-day cycles like clockwork, and now they're shorter, longer, or just inconsistent. So the time frame can change. Also, the kind of flow can change. So some women will have really heavy periods during perimenopause. Others will have spotting. Often there'll be a mix of both. So oftentimes the hallmark to those more physical symptoms is just anything goes. So it becomes more erratic. A lot of the symptoms are not so obvious. And so they're more related to mental emotional symptoms. So we see more anxiety, depression, sometimes insomnia during the perimenopausal years. You ladies know already, this is a lot of crossover with adrenal symptoms. So we will get to that in a minute. But just looking at when the female hormones change, those symptoms can come just from that, not necessarily including when the adrenal hormones are also part of it. Another hormone that really shifts during the perimenopausal years is testosterone. So sometimes stamina can be reduced, body composition can start to change, so it can be harder to gain or maintain muscle mass. Metabolism can be a part of that as well. Libido can decline, that can be a part of it as well. Sometimes other hormone systems come into play. So we're going to be making that connection with the adrenals, but I also just want to mention here that thyroid hormones can shift during perimenopause too. I always like to make the point to people that hormones don't act in isolation, right? So they're just all part of sort of like this mix in your blood. And so it's more like you want to think of a symphony where they're all interconnected. You can't necessarily separate the notes, right? You might be able to recognize the instrument that's making them, and sort of that can give you some clues, but you really want to think about them all acting together. So as the ovarian hormone production declines, which is what happens when menopause or perimenopause happens. The ovaries reduce their production of hormones called LH and FSH. And that will affect the sex hormones, but that shift can also really affect all of the other hormones in your body too. So if you think about, I won't go too much into thyroid symptoms today, but things like fatigue and metabolic issues that might come with perimenopause can really be exacerbated if thyroid issues are also part of the picture. And then last, kind of lesser known symptoms, sometimes that crop up here during this time frame are cardiovascular symptoms. So I will see a lot of patients come in with new onset, like palpitations or maybe blood pressure changes and things like that. And so oftentimes it's the decade of life where people get put on medications, maybe cardiovascular medications, when that might be appropriate. And obviously you want to talk to your doctor and do more investigating to figure that out. But it could also be the early stages of hormonal shifts. And so sometimes if you can address the hormones earlier on, then you can resolve or at least alleviate or reduce those symptoms too.
I'm definitely seeing a lot of crossover with what you're sharing with us about just adrenal fatigue in general. So either the two go hand in hand or they're maybe misinterpreted, or I could see that happening as well. And I wanted to ask, I also wanted to mention too about the heart palpitations. We had that, we just had a podcast last week, I believe we shared with you all, and on air hunger. And so I think just bringing that back to the cardiovascular piece. So just another nice connection. So listen, if that's an issue for you, that's something that you want to check out that podcast as well.
Yeah, it truly is fascinating to hear how many of these symptoms resemble so many of the symptoms as women, men too, but are complaining to us about in our adrenal recovery community. And a question that just popped up while you were going through that, Holly, just so women can know, and actually I know there's a form of like menopause for men, but we're focusing more on the women's version of it today. I think it's called something different. I know there's menopause, something like that.
Andropause.
Oh, andropause. Okay. Yeah. That's a conversation for another day. But for the women out there wondering, like, am I in perimenopause? Like, when does menopause typically start? And so how early, I'm thinking age-wise, like, age-wise,
great
just
question.
for a reference for women out there.
Yeah. So the average age for menopause is 51. And so the average age for perimenopause can be up to 40, 41. And that's when symptoms can usually start and can be attributed to perimenopause.
That's really interesting, because I think a lot of women don't realize how early these changes can begin. And so when they're starting to experience these symptoms, it's like you're not even thinking about the hormonal shifts that are naturally taking place in the body. And I know we're going to chat about how stress can exacerbate and influence these symptoms even more. But one thing I just was thinking of when you were saying that, and I've heard in instances where people maybe reach for certain balancing herbs, like for instance, chaste tree, and use them for a long time at a certain dose, but maybe not using it under mindful recommendation from a practitioner, can actually, because it's such a balancer, certain herbs can actually accelerate the process. So can actually like speed up your journey to menopause. Have you heard this before, Holly?
I wouldn't necessarily say that I've seen it speed up. I do think of chaste tree also as a balancer. So it regulates and it'll shift in the direction kind of where the body wants to go. So I think of, when you say speeding up, I think of it as like more of an aggressive process. And I don't think of chaste tree as having that kind of effect. But anytime I recommend chaste tree, I always warn people, like, your cycles might get weird for a couple cycles because they're trying to like recalibrate here. I want to say clinically, I think I've seen more the other way around, where oftentimes I'll have perimenopausal patients on herbal protocols, and maybe they have skipped like 3 months of bleeding. This is when you're getting closer to menopause. And there's often this moments when women are getting closer to menopause where they're just like, okay, I'm really done having periods here. And so then they'll have kind of more intense perimenopausal symptoms, and they'll really benefit from the herbs, but oftentimes the herbs will make the periods come back.
Oh,
so
okay.
It's not, and I don't think of that as a bad thing. It's more, again, it's kind of regulating. And usually it alleviates the other symptoms they have that are really causing a lot of suffering. But I haven't really seen that be the other way around, where it stops periods sooner, which would be kind of speeding up menopause. So
okay,
maybe it is a thing and I just haven't seen it. But
yeah, I know I just kind of threw that out there, but it's interesting to see what you, and definitely interesting to hear what you've seen clinically.
Mm-hmm.
And I mean, nothing surprises me sometimes, the way the body can react to certain supplements, but it's always good when considering supplements. We always say it, just working with a practitioner who really understands what's going on with your hormones is really going to serve you in the long run, rather than just guessing, right? So at the end of the day, it's always wise to do that. And one other question that just popped up to me, like during perimenopause, women are still getting their periods and likely ovulating then. So women still can technically get pregnant during perimenopause.
Oh, yes. Yes. It's actually a very common time in life that women stop using contraception and get pregnant. So always have to have that as part of the conversation too.
Okay. So good to know.
That's a good part of the conversation. Yeah. So is perimenopause like a natural process, or can it be negatively or influenced? And I'd love to know your take on that.
I do think it's a natural
10-year window. Yeah.
I think it's normal for those ovarian hormones to decline. I think the presence or absence of symptoms varies a whole lot. So I think a lot of women will navigate perimenopause with no problem and no awareness that it's even happening. Others, it's the complete opposite end of that spectrum, right? Where they're already, at 40, they're having hot flashes and they're still menstruating, and they will be for a while, but the symptoms can hit people really hard. So I do think it has some relation to kind of the state of health you're in when you go into those years, and sort of what your reserves are for hormones. And there's so many things that can influence that, of course. But I think biologically it is normal, for hormones to start decline in those years.
Okay. And so you were saying that, like we were talking about like the stress piece, and of these symptoms. And so you were saying that the ovarian function slows down in this period, and is it true that the adrenals then take up a lot of, or kind of take on some of the responsibility to make those sex hormones after the ovaries slow their input?
Yes. And I think that's part of what can determine whether perimenopause might be more or less challenging for someone, is that because your adrenals produce DHEA, which is one of the ways sex hormones are made. So sex hormones, I'm talking here about estrogen and testosterone. And when ovarian function declines, the demand on the adrenals goes up, because your body will try to it has lots of different wise checks and balances, right? And so because your adrenals produce that DHEA, they should produce enough of the sex hormones to have the symptoms be tolerable or mild, right? So if you're going into the perimenopausal years and you already may have some adrenal hypofunction, so maybe you've had a lot of stress and your adrenals have been focusing mostly on producing cortisol, then your DHEA levels will be lower going into it. And so you just don't have the reserve that would naturally be there when those ovarian hormones start to decline. There's not enough DHEA reserve to kind of kick in and make up for the lower estrogen and testosterone. And those are the patients that I see often have, especially the, I would say some physical symptoms too, but especially the mental emotional symptoms can really be a struggle during that phase. And also the metabolic symptoms can really be difficult. So changes in body composition, and it's really harder to maintain a healthy body composition when the adrenals are also part of it. So does that answer your question?
Yeah. So essentially that's how living with chronic stress and adrenal issues leading up to perimenopause can really influence those symptoms. Mm-hmm. And it's because your body just doesn't have the reserves.
Yes.
To make that transition as easy as it should be.
Yeah, exactly. And usually that makes perimenopause more challenging. And then menopause and postmenopause will also continue to be more challenging. So I love it when patients come in, during perimenopause, especially earlier perimenopause, and want to start working on stuff, because it's always easier to sort of head things off than to come in after someone's been really depleted and deficient for a long time. It can be done, but it's so much nicer and alleviates or prevents so much suffering when they can come in earlier and start looking at some of these things.
That's such a good point. So don't wait till it's too late.
Yeah. Well, it's never too late, but prevention is definitely key. Yeah.
But yeah, listen to those little whispers that your body is giving you. Don't wait till it's screaming. That's what I like to say.
Mm-hmm. Yes.
But if it's already screaming, I mean, just start where you are.
Yes, exactly. And then know that there's great practitioners out there like you, Dr. Holly, who could help with it, make this a little bit easier. Okay. So I think we all want to know, what can we do, or all the listeners out there, what they can do to help make the transitions easier? Mm-hmm. Besides obviously chronic stress, we already know is an influence. So what are some other ways, or we can talk more about that too?
Yeah. So I think just to kind of come in on the heels of chronic stress, I think a lot of our body whispers are sort of messages to have us reassess things, right? So, Angela, I think this is something that you talk to clients about a lot, is just sort of looking at habits and things that you might be doing, or ways of thinking, ways of being that might not be so life-giving, and kind of reassessing that. So I often find this is also a decade of life for a lot of women that is really busy. So especially with this, what we call the sandwich generation, right? Where women in their 40s are often caring for sometimes pretty young children, sometimes even still having babies. And also they start caring for ailing parents. So many of my patients come in and there's just so much on their plates. And I know a lot of people are probably shaking their heads hearing that and thinking yeah, that's just how it is. That's what's on the plate. But a big part of what I encourage people to look at is, okay, well, is there something you can take off the plate? Where can you call in support? And then I have people talk to you, Angela, about ways to kind of reframe what is in their lives and shift how they're coping with stressors. I think that's a huge, when in naturopathic medicine, we're always looking at, well, what's the root cause? What's the underlying thing? And that's a huge one right there. There's nothing in a bottle that's going to fix that, right? If that's part of kind of their life, which is always sort of, people don't really want to hear that. Right? And I don't either, right? I'd love to be taking an herb or taking some kind of, no side effect pill that could make my life feel less stressful.
Yes.
But it's such a critical component.
It is. Mm-hmm. And noticing your tendencies, right, for either overthinking, which tends to go to overwhelm, when you have chronic overwhelm, you tend to go to the places of anxiety or depression. Those are obviously all linked. So I think when you were saying it's a time of that sandwich generation, I think that's such an interesting, I've never heard it put that way, but it's so true. And I'm in that phase of my life for sure, in a way, not quite with the parents yet, but just the kids. And I'm almost there, but age-wise, I'm there. And I think it's just important for us to, it's also, it takes a little bit of introspection. It's a time where I feel like it's a time where we should be, and we really need the time to reflect, right, on what are our habits, our tendencies that are creating chronic stress that could be affecting our health. And often that time, there's no time for that. So it does maybe take a little extra initiative to seek out those support systems for emotional and mental support.
Yeah.
At the same time as dealing with our health and our families. So it's tricky. It's doable, but it's tricky.
It's so, I mean, we could have a whole podcast just devoted to this, because it's also so fascinating how much of it is culturally driven, and how much, you know, I think probably all of us were sort of raised to think, you know, women should sort of put their needs last. And it's always a big part of the conversation here is, you know, that's done. that paradigm shift really needs to happen. Yes. And it has to start, you know, it has to start somewhere. So might as well be with us. Right. So that's a whole other topic. And I'll go into other things that might be a little easier to help make the transition easier, but it's not something that can be avoided, in my opinion. So other things are just, some of it's the foundational self-care stuff, right? So people also struggle with these things, but it's looking at how much are you sleeping? You know, are you prioritizing sleep and rest in your life? And this has a lot of overlap with the busyness, but kind of trying to remind people that hormones really can't be healthy if you're not sleeping, you know? And so you're looking at quantity there and quality. I don't really go into specific like numbers or hours of sleep too much. You know, I have general rules with that, but the first and foremost is just looking at, do you feel like you're rested when you wake up in the morning? And if not, you know, let's assess your sleep. Other things that I think are really critical, Danielle, I'm sure you talk to people about this a lot, but just looking at the nutritional piece, you know, looking at, are you getting the right ratios of macronutrients, which are protein, carb, fat? Are you getting the micronutrients you need to have the building blocks to even make healthy hormones? You know, there's not much that's going to happen if you're lacking in those things. I don't know if you want to add anything in there, Danielle, because I know this is your
it's just so important, right? I think one of the things I love about food is if you're feeling tired, and the way that it can shift your energy levels so quickly once you get that dialed in. And if you have trouble sleeping too, sometimes it's sensitivities. And I see that like way too frequently, where somebody just takes one thing out of their diet and suddenly they're sleeping so much better. Yeah. So just like investigating all of this stuff, right? All of these puzzle pieces come together, but I love when simple tweaks to the diet can make such an impactful, influential change just in supporting adrenals and hormones.
Yeah.
And just good health in general.
Yeah. Yeah. And I think of it as just paving the way to a healthier second half of life, right? Because we're looking at kind of middle age going forward. We're also thinking about health risk factors that increase in the perimenopausal and postmenopausal years. And you're sort of wanting to look again at the foundation you're laying for the second half of your life. And so diet is, I think, just a huge part of that. Yeah. And then going into more specifics with that, you know, I will often go deeper with patients when I have more insight into their individual patterns, because again, all of these hormones are shifting. And so there's not any one herb or one product that's going to be right for everyone to smooth the transition. But I do think this is a time in life where, again, if stress levels are high, or if coping skills aren't super solid, then you can get some support with the plant adaptogens. So a lot of the adrenal support blends can be helpful to kind of ease the transition. If the hormone pattern looks more like the sex hormones are really impacted, then sometimes there are herbs that can help with that. And again, I really like to do testing to kind of see what's happening here, but there's a lot of options for support out there. Sometimes it's nutrients too. So again, if depending on their history, some nutrients might be low going into this transition, and sometimes there are certain nutrients that are really depleted with chronic stress. And so again, kind of boosting those up either through diet or sometimes through supplements. So really, there's no reason to suffer through perimenopause. I think it's absolutely something that can be managed really well with complementary or naturopathic medicine. And I always encourage people, like I said, to get help sooner rather than later if they're having these symptoms, because it's certainly, because of the whole sandwich generation thing, I think the decade of life where perimenopause is happening can typically be pretty challenging. And so I love when people are kind of like calling in some allies to help with that.
Totally. Those are wonderful tips. So I'm sure those tips apply whether you're whether you're in perimenopause, whether you're not there yet, or whether you're already in menopause. One thing I just wanted to highlight, like whether you're already struggling, if you are already struggling through perimenopause or menopause, like it's possible to make these changes and build reserves back up. Mm-hmm. And that's what you're saying. And so as a rule of thumb, what we tell people in our adrenal community is, as a rule of thumb, for every year you've struggled with like extreme stress on the adrenals or adrenal fatigue or burnout, it takes about 1 month per year. So like hypothetically speaking, you've been struggling for 3 years, or maybe more, 5 years with chronic stress. Like give yourself 5 months to like really focus in on this stuff. And I mean, hormones take time and they always take time, but even if it was a decade, right, it's possible. It's possible to make these changes. And so there's always so much hope for those of you out there listening to make this transition lighter from here on out, or lighter as you move into it in the future. So I'm really so excited to share this info with everybody today. Thanks, Holly, for these tips. And I guess the last thing is, if we are there already, all of the tips you just shared obviously would apply. Is there anything extra that, if you're already really struggling, that you would recommend?
I think this might not answer that directly, but in the topic of making the transition easier and what to do if you're already there, I've kind of hinted at this, but one thing I really suggest is to get some adequate testing done. I really think this is an area where conventional medicine comes up lacking for so many women. Even if you have a provider who's really savvy in doing like bioidentical hormones and things like that, it's not necessarily a big picture approach. And it's rare that I even have patients come in who have had any hormones tested. So I think, one, try to get some hormones tested. And two, I think getting a test, which I know we do a lot of Dutch testing, and the Dutch Complete Panel that I do a lot of has an adrenal test alongside a test for the sex hormones. And it also includes some nutrient tests too. So it's doing that broad view of what's going on with the hormones. And I will say, sometimes patients come in and I support wherever they are, right? Sometimes they don't want to do testing, and I'll say, okay, this is my best guess at where you are. And there's still a lot that can be done with just a really great intake and kind of getting a sense of where they are. But I certainly have been wrong, with those patients. Sometimes we'll do a trial of treatment and then maybe they don't respond the way we hope. And then we do testing. There might be a hormone on there that's off that just wouldn't typically be off in that situation, right? So I can't stress enough that I think that that's really empowering to get that information. And also it's validating for patients to come in and see, okay, yeah, this stuff is my body chemistry and it's, off in XYZ ways, and here's how we can correct it. And that's just not really a part of conventional medical care. Like I said, perimenopause just isn't even really a part of the conversation. So if you're there already and maybe trying to figure out options, I want to say too that menopause doesn't signify the end of a lot of these symptoms. Unfortunately, a lot of them can continue, and sometimes they worsen. I have patients come in that are, 60, in their 60s, even 70, that are like, I've not slept in 30 years. It's like, oh my God. Okay. So there's a lot that can be done at any stage of the process. And it is sort of the same foundational pieces that I already talked about, but it might be different levels, right? So there's kind of a spectrum of different options for herbs. I do sometimes do bioidentical hormones. So I do think there's a time and a place for those. Certainly only with a lot of testing and information. Would you want to do that? I certainly don't recommend going it on your own with that kind of thing. But yeah, I think like you already said, there's no point at which you should give up hope with this. There's a lot that can be done to help.
Yeah, I think this is just so empowering. I actually got goosebumps while we were talking, because I think so many women do struggle. And it's just now in this day and age, there's just so much available to us to dig a little deeper and get answers and streamline this whole experience, or this recovery experience. And this is what we help people with every day in our programs. So if anyone out there is listening, wants more support, please check out the resources in our show notes, book a complimentary call with one of our coaches. We can give you a free assessment and just see where you're at, and we can go from there. So know that you can totally change the waves if you're struggling now, and you can change the trajectory of your perimenopause and menopause in your future, and hopefully breeze through it with ease and grace when it comes, or at least make things easier if you're there now and it's not feeling that way. So thankful for all this information that you've shared with us today, Holly.
Yeah, you're welcome. I'm happy to share it. It's one of my favorite topics. So thanks for inviting me to be here.
Well, you're definitely an expert on it. We appreciate it so much. And I love just the hopeful message you share. Is there's so many things that you can do, and it's never too late. And but it often does take a holistic approach, which is what we love and we're all about here at the Adrenal Recovery Collective. And so if we can support you in any way in doing that, let us know. And it's been, again, a pleasure to be with you, both of you ladies, powerhouses. I'm excited to give this information to all of you. I hope you gain some awesome awarenesses today. And with that, I think we're call it a wrap today.
Yeah, thank you, everybody, and happy holidays. We'll see you in 2021.
It's the week of Christmas. And so, yes, happy holidays to everybody. And thank you again, Dr. Holly, for joining us.
Thank you, ladies.